Hi, I'm Dr. Tim McFarland, and I've been in private practice for over 30 years. The past 4 years, I've been working as a hospitalist and an emergency room physician. In all those years, I've had a large nursing home practice. I want to take a moment just to encourage everyone to get the COVID-19 vaccine. I want to take a couple of minutes to answer some questions that have been raised that would discourage people from getting the vaccine. Indirectly, I manage over 500 nursing home residents. I don't know if you realize this, but 1/3 of the deaths from COVID-19 in the United States is in nursing homes, either residents or employees. But I was startled and disappointed to hear that at one of the nursing homes that I work with, over 70% of the employees opted to not get the COVID-19 vaccine. In my work in the emergency room and in the hospital, I've seen people get sick and die of COVID-19. But nowhere I've seen COVID-19 be as devastating as in nursing homes. Through a lot of work and great expense, we now have a vaccine for COVID-19. Operation Warp Speed is one of the things that President-elect Joe Biden praised President Trump for getting done and pushed through Congress as fast as he did. Don't you long for life to return to pre-COVID times? I'm tired of wearing masks. I'm wishing that my niece could have had the big wedding that she really wanted to have. People are dying and not having a funeral. Don't you want to go to sporting events, movies, concerts, normal church activities, bars, restaurants? Don't we all want the economy functioning? I think everyone would want things back to normal. And now we have a real way to make that happen in the next couple of months, the COVID-19 vaccine. But 85% of the population need to get vaccinated to stop this disease. You know, testing these vaccines is just starting for people under the age of 16. So that means everyone that can get the vaccine needs to step up and get vaccinated. I got my COVID-19 vaccine the first day that it was available to me. I hope to get my wife vaccinated this week or next week, as soon as it's available to her, and my mother, and my children, everyone, because I am tired of this disease. And as everyone is as tired of COVID-19 as much as I am, why are some people not getting vaccinated? Well, some people say that it was done so fast it's not effective, or maybe it's not safe. And indeed, the speed to make and develop this vaccine has been remarkable. It's a testimony of the hard work, working together, the sharing of information, and most importantly, cutting through the red tape of government bureaucracy. But these vaccines have been completely tested. If you've ever had your identity stolen or lost your Social Security card, you know that fixing problems that involve the government can take a long time. Don't you wish someone would fix everything related to your stolen identity in 30 minutes? I'll be honest, that won't happen. But Operation Warp Speed did just that for the COVID-19 vaccine, including the United States government paid $6 billion for this vaccine to get fast-tracked. Quality and testing have been thorough, but fast is good. But now I hear people saying fast is bad. Fast does not imply a poor quality vaccine. It was thoroughly tested and it's very safe. It was fast-tracked because COVID-19 is so deadly and so disruptive. Statistically, the vaccine is very safe. Of course, our other options are to continue to get sick with COVID-19, that's bad or deadly, or to just keep shutting down normal life activities. Some may not want the vaccine because they're afraid they can get COVID-19 from the vaccine itself. Well, this vaccine exposes you to the protein on the COVID-19 point. It's not the whole virus. This also helps because as the COVID-19 virus mutates, the vaccine will still give you immunity as long as the pointy protein doesn't mutate. And mutations are one reason for everyone to get quickly vaccinated. That vaccine is very effective against the COVID-19 virus. But if people wait months or years to get vaccinated, the immunity may not be as helpful. Waging war slowly may be much more detrimental on a lot of levels. I hear some people say that the vaccine is injecting a radio transmitter so that the government can monitor your movements. Well, here's the size of the needle that's used for the COVID-19 vaccine. I don't know what science fiction movies you're watching, but we do not have transmitters that are small enough to go through a needle so tiny. And think about this, the government's wanting nursing home residents to be the first to be vaccinated. The reason because COVID-19 infections are so lethal to this population. But if the government wanted to track people's movement, do you really think they would start vaccinating nursing home residents first? I mean, do they really care if Mrs. Smith is taking a shower? Or do they really want to know if Mrs. Jones went to play bingo or not yesterday. Time is important. One nursing home that I work at has about 100 residents. Not one employee or resident tested positive for COVID until December 2020. They will get the vaccine January 12th, 2021. But in the month of December, over 50 residents out of 100 tested COVID positive and 8 had died. So if you did not enjoy 2020 as much as you'd planned, and COVID-19 messed up your things that you wanted to do just like it did for me, please get vaccinated as soon as you can. I did, and I hope you will too. If you have any questions, you can go to my website of paradoxify.com where we have several podcasts on COVID-19 diseases. Thanks.